Vanessa Toucanet says this supervised drug consumption site in Thunder Bay, Ontario, saved her life twice.
And a couple times that I've been there, I've overdosed. And when I think about, had I not been there, I wouldn't be alive.
The site is one of 10 the Ontario government is shutting down.
I just really can't get over how many people are not going to make it as a result of it closing.
The closure largely stems from a tragedy that happened more than 1,300 kilometers away. A mother shot and killed last summer as she walked by a supervised consumption site in Toronto. The province ordered a review of the program. The report delivered by experts calls it a necessary public health service and recommends expanding supervised consumption sites in Ontario, not closing them.
It'll be one question, one follow-up.
A reporter asks Ontario's premier why he ignored the expert advice.
And I was just wondering how you would feel if I stuck one of these beside your house. You wouldn't like it. Matter of fact, I know you wouldn't like it, neither would your neighbors and neither would anyone else. And all the kids, they shouldn't be by schools, they shouldn't be by daycares.
The 10 sites Ontario is closing are all within 200 meters of a school or childcare facility. The Ford government is not allowing them to relocate.
If you're not going to create a pathway by which these services can become compliant, then it's really just a pretext.
While people living around the sites complain of used needles and discarded syringes, advocates like Dan Werb argue shutting them down won't help.
This will likely lead to higher levels of public drug use.
Ontario is promising to create 19 new addiction treatment hubs, which won't allow consumption. That makes experts question whether addicts will be willing to use them. Mike Crawley, CBC News, Toronto.